ZOLGENSMA, onasemnogene abeparvovec-xioi, is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
I learned of Lucy's SMA diagnosis through newborn screening. We never heard of SMA. We had no idea what SMA was, had no idea that we were both carriers.
We had an appointment with a neurologist where we learned what her diagnosis actually meant for her.
At the appointment, they ran testing to confirm that she did indeed have SMA. She said that she only had 2 backup genes of SMN2, which historically went with type 1. Lucy was 11 days old when she was diagnosed.
We were told that without treatment, children diagnosed with SMA type 1 typically won't live past 2 years. But we were also receiving very good news that there were treatments that had been FDA approved and that actually carried a lot of hope.
Our neurologist told us about 2 treatments, and one of the 2 treatments was ZOLGENSMA. After doing a lot of research and contacting other families, we felt that that really was the avenue that we wanted to go down. Our doctor wanted Lucy to receive ZOLGENSMA because she saw very promising results. She said that it kind of halts the disease progression. She looked at Lucy and said, this is the one that we need to pursue as soon as we can. She said, right now Lucy had a lot of strength. She still had a lot of vibrancy in her.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
There was blood work that was administered in order to make sure that she was a candidate and to establish her baseline levels. Lucy started taking the steroid a day prior to the infusion as directed by the doctor. Going into infusion day, Lucy didn't show any signs of SMA.
Lucy received treatment with ZOLGENSMA when she was 38 days old. Treatment day was kind of more of a peaceful day, believe it or not.
That morning that we arrived to the hospital, we just kind of knew that we could take a little bit of a breath and say, okay, we did it, we made it this far. After treatment with ZOLGENSMA, she did have the elevated liver enzymes. They did do the blood work to track. Today, as a 1-year-old, Lucy is able to breathe on her own. Lucy is able to sit in her high chair. She picks up her own drink. She's crawling. She's climbing all over the furniture. She loves to dance. She loves to laugh. She can stand with assistance, and she can even stand on her own now for a couple of seconds. We continue to work with our doctors and her medical team.
Lucy does receive physical therapy every week. It's important because it allows us to continually track her progression and make sure she's continuing to meet her milestones.
For her to be treated so young, to meet so many of these milestones for us, it exceeded anything that we ever could have expected.
ZOLGENSMA gave Lucy a chance to live a life in defiance of her diagnosis so that we could see her smile, we could see her meet her milestones, get to meet the person behind Lucy.
Hey, look at my glasses. What are you doing with those?
One day I hope that we see adults, teenagers, and children just all out living daily life, and there's people out there in the community that have SMA that you wouldn't even know were diagnosed.
Going up. Going up.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. Zolgensma was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about Zolgensma? Zolgensma can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with Zolgensma and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with Zolgensma? Infections before or after Zolgensma infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with Zolgensma. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after Zolgensma infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There is a theoretical risk of tumor development with gene therapies such as Zolgensma. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after Zolgensma infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and Zolgensma? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to Zolgensma administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of Zolgensma may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with Zolgensma. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of Zolgensma? The most common side effects that occurred in patients treated with Zolgensma were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.